attention, please. Listen the begin softly. Am I audible, Komite? Suara saya kedengeran?
Assalamualaikum. Can you hear my voice? Boleh dengar tak suara saya?
Ya, boleh, Dr. Vivien.
Okay, thank you very
Very
much.
clear.
It's clear.
Can I? Okay, thank you. The lecture will be conducted in English. Is that okay and fine?
Yeah, well,
Sure.
Thank you very much. Let me know if it is ready.
okay, Doctor.
Yeah, you.
I will start the event now.
Sure.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi
Wabarakatuh.
Hah?
Good morning.
Dibuka biar yuk
Honorable Dr. Vidya Utama Trubus, our distinguished speaker, respected committee members, lecturers, invited guests, and all participants. First of all, thank you to the committee for inviting me as a moderator. It is my honor to serve as the moderator for today's guest lecture session. Today, we will discuss a very important topic beyond lifestyle and medication, integration environmental and occupational health into interprofessional chronic disease management. Topik ini sangat relevan dengan tantangan bagi public health because chronic disease management is often associated with lifestyle modification, medication adherence, dietary counseling, physical activity, and clinical treatment. However, as will be discussed in today's lecture, chronic diseases are also influenced by wider determinants, including environmental exposure, occupational hazard, socio-economic condition, and the places where the people live and work. Therefore, today's session will provide us with an important perspective on how environmental and occupational health can strengthen interprofessional collaboration in chronic disease management. Could you please display the speaker's CV on screen, committee? Minta tolong CV-nya di-share. Okay. Today, we are honored to welcome Associate Professor Dr. Vivien from the Department of Environmental and Occupational Health, Faculty of Medicine and Health Sciences, University Putra, Malaysia. Okay, from the CV, Dr. Vivien has extensive expertise in environmental health, occupational health, chemical health risk, agricultural health, disaster risk reduction, and climate-related health issues. Her academic, research, and professional experience reflect the important role of public health in prevention, risk management, community engagement, and intersectoral collaboration. With her strong academic background and extensive professional experience, Dr. Vivien is very well positioned to share valuable insights with us on the integration of environmental and occupational health into interprofessional chronic disease management. Bapak Ibu, please join me in warmly welcoming Associate Professor Dr. Vivien. Dr. Vivien, how are you?
Assalamualaikum dan salam sejahtera. Selamat pagi semua. Thank you very much for having me today. I hope my line is clear.
Yeah, very clear.
Okay. All right.
We have 15 minutes for presentation and we'll continue with discussion or Q&A session after.
Sure, no problem. My
Yeah, Dr.
pleasure.
Vivien, the screen and time are yours.
Okay. Boleh nampak skrin saya tak?
Not yet. Oh, okay, sudah.
Sudah. Okey. Terima kasih banyak. Assalamualaikum dan selamat pagi sekali lagi. Saya tak sangka ada 341 orang yang join. Saya ingat less than that. And that is a lot of the participants that I see in front of my screen now. Thank you very much for support. I'm Vivien. You can just call me Vivien. And I'm honored today for meeting the students and also the lecturer from Chandakera Utama Health Technologies Institute Kudus today. As mentioned by Ibu Yagyu, my background is in environmental and occupational health. And so I will bring a slightly different way to chronic disease management. Right. So usually when we talk about chronic disease, we discuss about lifestyle, hidup macam mana, sehat ke tak. We talk about medication, we talk about ubat. We ask about food. We ask about exercise. We ask about smoking, your blood pressure, your blood glucose, and medicines. These are all very important. But today, I want us to go one step further. I want us to ask, where does the patient live? Where does the patient work? What does the patient breathe? What does the patient touch, eat, and get exposed to every day? This is the missing part that environmental and occupational health can bring into when we talk about interprofessional care. Now, I got to know that we have a student from a different background today. Would you mind to type in the chat box what background you are from? Type in the chat box telling me if you are from public health, if you are nursing, if you are pharmacist, what background are you from? So that I can understand you better. Can you type in the chat box now? Whoever can do the typing. Are you from the public health? Are you from nursing? Are you from pharmacies? Are you from occupational health? Yang mana? Pharmacies. Thank you, Susan. So we have someone from pharmacies. Lagi? Apa lagi background ada? Ada siapa-siapa daripada public health? Anyone from nursing? Right. Ibu Ya, you from nursing. Alright. Lagi? Come on. Lagi. Anyone from public health? Anyone from School of Public Health or bachelor's degree in public health? Ada tak? Okay, never mind. So we know that you are coming from the health sciences from a different background. So you have from public health, nursing, pharmacy, and so on. And what make it different when we say that chronic diseases is beyond lifestyle and beyond medication? You look at this graph. This slide shows us one big message that chronic disease are not a small issue. They are one of the biggest health challenge in the world. The number of the slide is very small. The number of the slide is very, very large. In fact, why do I say this? Because there are billions of deaths every year related to non-communicable disease. Maksudnya dalam setahun ada 41 million kematian, which include cardiovascular disease, cancer, chronic respiratory disease, diabetes, and many, many others. For public health, this means that prevention must happen at the population level. For those who are coming from nursing and pharmacy, this means that there are more and more patients that we have to meet every day because they are living in a long-term condition that need medication and care. But for the rest of us, the question is, are we managing only the disease or we also manage the cost around the patient? So now let us look at how these diseases are projected to change over time. This graph shows that the death from a several chronic disease are expected to increase over time. We look about cancer, heart disease, stroke. Semua akan naik. This is important. Yang ini penting because the chronic disease do not happen suddenly. They develop slowly and they're often over many years. That means we have many chances actually to prevent them early. And prevention cannot depend only, keep telling people to change their behavior. We must also understand the environment that shape their behavior and also their exposure. Why do I say so? For example, this is what we know. We talk about the risk factor. And right, when it comes to the standard non-communicable disease approach, kita akan cadangkan pesakit makan sehat, exercise, apa lagi? Jangan merokok, jangan minum, kena jaga badan, kena makan sehat, right? These are what we suggest for the patient. But this is when the risk factor are related to behavior. We know that by suggesting this, we can change their behavior. Or their physiological risk factors. Or maybe because of their genetic. Contohnya ada yang kata, my family are diabetes. So then I also having the high risk of having a diabetes. My family had a heart disease. So I'm also the high risk of having the diabetes or heart disease. So all of this can be treated with the standard non-communicable disease approach. So just for record, NCD, it's mean the non-communicable disease. Okay, just for the record purposes. Now, non-communicable disease can be many things. Can be diabetes, can be heart disease, can be a high uric acid, high cholesterol, everything, we name it. Now, this is workable. We ask people to stay healthy, eat healthy, jangan makan manis, makan sehat, and so on and so forth, right? But what if there is another important layer, which is social and economical factors? So this slide actually telling us another thing, poverty. Poverty, maksudnya miskin, is not only about having no money. It also means that they have not enough resources to live safely and also healthily. Relative poverty means the family are not able to meet the basic need. They don't have the safe housing, they can't find the good food, that there's no clean water, no education, and cannot access to healthcare. Secondary poverty meaning to say they earn some income, but they spend a lot just to cope with the stress and difficult working condition, meaning to say that they are so poor that they cannot access to the healthcare and cannot even get the healthy food. You want people to eat healthy food, they need to have money to buy the healthy food, right? If people are in poverty, they cannot buy healthy food. You want people to stay fit, exercise selalu, but the thing is they work 24 hours a day. So they don't have the time to exercise. So that is what we call about socio-economical risk factors. And when it comes to socio-economical risk factor, we have to question whether the standard non-communicable disease approach is still relevant to this group of the people. And then what if we combine everything together? Behavioral risk factor, physiological risk factor, genetic risk factor, and socio-economical risk factor. These are all the risk factors that when we combine together, it's lead to the chronic diseases. So stop saying there's chronic diseases. You have the diabetes because you malas, you makan tak sihat, you tak nak exercise. It's not only about that. It's maybe something more than that. They don't have the time to exercise because they have to kerja. They don't have the money to buy the healthy food because their financial is just enough for them to buy this much of food. For example, their lifestyle is like this, so they can't change. So what are the other factors? As I mentioned earlier by Ibu Yayu, my background is environmental and occupational health. So I concerned about the environment. So here, the environmental risk mean all the external physical, chemical, biological, and the work-related factors that would affect health. In simple words, it means the things around us that can influence our body. The air that you breathe, the water that you drink, the chemical that you expose, the noise, the heat, the housing, the ventilation, and the workplace condition. This is why environmental and occupational health are actually very much relevant to chronic disease management. Because why? You attend patient, right? The pharmacy see patients, the nursing see patient, but the patient do not live in a clinic. Patient balik rumah. So when patient balik rumah, they live in a home, they travel on the road, they eat food, they work in the job and breathe the air every day. So these are the environment that actually somehow indirectly causing them to have a certain diseases. Why do I say so? You look at this. Number one, we talk about air pollution. So air pollution is one of the most important environmental risk factor for chronic disease. Many people think air pollution affect lung, but air pollution can also affect your heart, your blood vessel, your metabolism, and even pregnancy outcome. You look at the graph here, it shows us that when it comes to air pollution, it affects many, many things. For Indonesia and Malaysia, we are very familiar with this topic. We know traffic pollution. We know industry emission. We know the haze. We know biomass burning and the indoor smoke. All of these are affecting our daily life. So when the fine particles that enter the lung, that can trigger inflammation. This inflammation can spread to the whole body and increase the risk of the heart disease that can cause stroke, that can cause asthma, cancer, chronic obstructive pulmonary disease, and even diabetes. So air pollution is not air pollution. Air pollution is about the environment that you live. That if you already have the asthma, now because of the living environment, it's trigger even more your asthma and also your heart disease and whatnot. The second one, we now move from air pollution to the toxic chemicals and endocrine disruptors. So this slide introduced the synthetic chemicals used in the industry, in the agriculture, consumer product. Some of these chemicals can enter the environment and later on they can enter our human body. One of the important group is endocrine disrupting chemicals or kita panggil EDC. Now, endocrine ini, kalau you tengok gambar di sini, it's very easy because this is our normal response. We have the hormone receptor, and we have the normal response. This is our normal response. But what happens if you're exposed to the endocrine disturber? If you're exposed to endocrine disruptor, it will asingkan this hormone, dia akan halaukan this hormone, and this endocrine disturber will go to find the hormone receptor. This is where you have the certain response. What kind of response that you have? You will have all the metabolite response. For example, a person, you might not feel sick immediately, but repeat exposure over many, many years, you will have long-term and low-level exposure that cause you having the obesity, diabetes, thyroid, cancer, development effect. All of them. Because these chemical endocrine disturbers, something we don't like, but they are so strong they can halau the hormone and get disturbed with the hormone receptor. Another thing. Let us know how they go into our body. So, how the chemical move from the environment to the human body, let us show you the pathway. First, the chemical will emit into the environment. And then it can move through the water, the air, and to the soil. And then it enter the food chain. And finally, people may be exposed through breathing, eating, drinking, or skin contact. This is very important because it seems like we are not direct contact to those chemicals, but even though you are not working in the factory, you are not working in the farm, you are not handling chemical, a person may not spray any pesticide at all, but you are still exposing to that. Whatever that you spray to the alam, you emit to the alam, will ultimately go to our human body. Our human body, our body is like the receptor. We receive everything coming from the outside, from the air that you breathe, from the water that you drink, from the food that you eat. All of this is where coming from outside, and it will ultimately go to your body. Okay, so that is what we call environmental health. And so what happened? Remember earlier we talked about the endocrine chemical? So when the endocrine chemical go into your body, it will increase the reactive oxygen species, what we call ROS. And if there's a lot of ROS, it will create oxidative stress. And if there is an increase of the oxidative stress, it can damage cell and affect normal metabolism. And so over time, this may contribute to metabolic syndrome. Metabolic syndrome maksudnya dia akan menjadikan high blood pressure, dia akan jadikan high blood sugar, excess body fat, and also abnormal cholesterol level. All right. So it means that everything that coming from outside, it will ultimately go to your body, and your body will trying to adapt to the chemical. The outside chemical go into your body. And so it's not something that, these chemicals, this air pollution, this contaminant go to my body and it's fine. No, your body will respond to that. And there's another thing. These are some of the very familiar household example like air refresher. Air refresher are common, right? It's common in Malaysia. I'm sure it's also common in Indonesia. It's very common in the whole Southeast Asia, I presume. Now, many people use this air refresher to make the room smell clean. But a small, nice smell does not always mean that you have the clean air. Why do I say so? Because some air refresher may release pregnant chemicals or solvent types chemical that can affect the indoor air quality, especially in a closed room with the poor ventilation. People who have asthma, who have allergy, the indoor air quality is very important. And another chemical. All of these in front of you are the industrial product, is our consumer product. But these consumer products are made for a certain purpose. For example, these are the sofa, this sofa or this baby bed, they are made from a chemical we call TBB. What is wrong with TPP? Now, TPP is made so that it is a flame retardant. Flame retardant meaning to say, let me just type it out. TPP is flame retardant. So flame retardant meaning to say that kalau andai kata adanya kebakaran, this sofa will still be a sofa. The baby bed was still there because that is fire resistant. Fire retardant meaning to say this is fire resistant. Dia tak takut api. Right? So this is the reason why we would add a layer of TPP on the surface. But what happens if we expose to that? If we expose to TPP for a long period of time, it would affect our endocrine system. It would affect our hormone. Another thing, cleaning product. All right. Most of our cleaning product, we have NMP. So this NMP is the purpose is to make the chemical softer, lichen, the chemical touching to lichen. Now, this NMP is very common in many things. What happens if you use that all the time? It will affect the development program. And especially, I want you to imagine, you guna cleaning product, you use the cleaning product indoor. And tempat cuci baju guna cleaning product is not ventilated. Tempat tu tertutup. And you are inhaling the smell of the cleaning agent every day. Can you imagine? And this is what we say, environmental exposure, exposing to endocrine system. And it will ultimately affecting our metabolite. And that is no wonder why today we have a lot of increased number of chronic diseases, cancers, endocrine disorder, metabolic disorder, banyak-banyak, macam-macam. And why it's usually only happen among the people, a certain group of the people. Because of this, imagine you are using the cleaning agent, tempat yang cuci baju, masa yang saya cakap tadi, tempat cuci baju tu tertutup. Tak ada tingkap, pintu tertutup. And then when you cuci tu, memang bau cuci tu naik and you are inhaling every day. Another example. Another chemical. So these are the chemicals that we usually put in the food or in the daily product that we are using. Especially when the ventilation are not well ventilated, you will cause disease, sakit kepala, rasa nak muntah, rasa gatal-gatal, rasa gatal hidung, and all of this is because of the chemical that you use. So when we talk about interprofessional care, here in front of me, we have people coming from different backgrounds. So when we talk about interprofessional care, if you are the nurse, then you might wanted to ask, guna apa product? Guna apa di rumah? If you are the pharmacy, you might ask about the symptoms and medicines. If you are from the occupational health, you might assess about the workplace exposure. If you are from the public health, you might ask, tinggal di mana? Sekolah di mana? What is the work environment and whatnot? That's another one. How many of you use the skincare product here? Can you raise your hand? How many of you do makeup? Personal care product, you use makeup, you use lipstick and everything. Can you raise your hand? How many of you? Okay, if you might be using certain makeup every day, but these chemicals in our personal care product, dry cleaning product, industrial degreaser product, protective clothing, they are small, very small amount actually. but you repeat exposure. That is what we call low dose cumulative chronic exposure. Low dose cumulative chronic exposure. So this kind of low dose and cumulative and chronic exposure to all these product will ultimately affecting us human body. And even more product, if I have to say, I think just now, Ibuya, you mentioned I'm a chemical health risk assessor. So I look into the daily use product and how it affects the human health. So, and also I wanted to suggest how can we choose the chemical wisely so that it doesn't affect us, our human health. Okay. And plastic. We all know about plastic. Plastic is an issue in Malaysia also. Plastic is an issue in Indonesia. Plastic is an issue in Thailand. Plastic is an issue in all Southeast Asia countries. Now, what happened to plastic? Plastic, what happened to plastic? Now, this slide shows that the life cycle of the plastic. From extraction, transport, refining, and manufacturing, consumer use, and waste management. At each stage, human can be exposed to plastic by inhalation, ingestion, or skin contact. Plastic is not only a waste problem, it is also a health and exposure problem. During production, use, and disposal, plastic may release the particle and chemical. Workers, community near the factory, consumer, and the waste handler all were exposed to plastic. But for the chronic disease management, the plastic-related exposure will remind us that environmental health is connected to respiratory disease, cardiovascular risk, endocrine effect, and possible long-term inflammatory effect. Why? Because, remember just now, the plastic from kilang, plastic in the air, plastic from the consumer product, and then the toxic waste, plastic waste, it will all ultimately go to the human body. And once it enters the human body, it will go into our body. So what happened? Then they can go to the human body through the food that we eat, the water that we drink, and also even when we're breathing, that is a microplastic in the air. So the idea is about the circular exposure. What we throw anyway does not just disappear like that. It can come back through the environment and the food chain. This is what we call public health. When we talk about public health, it is not about the food that they drink, the lifestyle that they live, but also the environmental that they're exposed to. Now, another thing that I wanted to mention is urbanization. Right? Urbanization changed how people live. We have road, we have building, we have transport system, we have green space, we have food environment, a lot. For example, a good green city meaning to say you have the safe sidewalk, you have the park, you have the bicycle lane, you have the shaded walking area, you have people who may move more. But if the area is crowded, banyak kereta, panas, polluted, tak selamat, right? And then we ask the people who are having the obesity, diabetes, respiratory disease, we ask them to go do exercise. How you want people to do exercise if, let's say, the city that you live or the campus that you go to school were having the difficulty for them to do exercise. Nak buat exercise, nak buat jogging, tak boleh. Kenapa? Because the roads are so crowded. There is a motor coming by, there is a car coming by, there is no room for you to do the exercise. Because if I have to do exercise, meaning to say I'm inhaling the pollutant air, it would increase the cardiovascular disease. It will increase my respiratory disease. So when we talk about urbanization, it's also about are we having the enough space for people to do exercise? Remember earlier we said non-communicable disease, one of the way for us to do is to ask people, to advise people to do a physical activity advice. So now the next question is, every time when we advise people to do the physical activity, do they have a space to do a physical activity? Ada tempat tak untuk diorang buat exercise? Or you want people to go for gym? If they are really poor and don't have enough time to go to gym, then what is the space that you have for them to do the exercise? All right. So that is the whole idea. And let's look at this graph. I try to summarize everything into one so that you can see the picture, and which I'm going very slow now. Number one, we talk about environment, air pollution. So you can see that, imagine if a patient with asthma, hypertension, diabetes, the patient take medicine, but the condition is not well controlled. Now then we ask the patient, kenapa you dah makan ubat, tapi you masih ada asthma, you masih ada hypertension, you masih ada diabetes. Why? Then try to ask the patient, does the patient live near the heavy traffic? Or maybe they work near the industry emission? Or maybe when they cook with the poor ventilation? Or maybe they experience haze? These are all the sources that can produce fine particles and irritants that exacerbate their asthma. No wonder their asthma, walaupun dah bagi ubat, walaupun dah advisekan macam-macam, but they are still the same symptom. Why? Because of the environment that they live. Because of the tempat kerja yang diorang kerja. So the biological pathway, the second one in the middle, is very simple. Fine particle you inhale, the lung will become inflamed. And the oxidative stress can increase. And the systematic inflammation can affect the heart, the blood vessel, the lung, and the metabolism. So the air pollution is not only an environmental issue. It is a chronic disease issue. And it involves public health chronic disease management. Another example, toxic chemicals. So if we have to, just now we talk about the toxic chemicals. Now let's dissect them into 3 different factors. Heavy metals, endocrine disruptors, and the industrial chemical. Heavy metal we mentioned just now, the lead, the mercury, the arsenic, the cadmium. All these come from contaminated water, fish, paint, mining, battery industry. That can affect the nervous system. That can cause us increase our blood pressure, affect our kidney, and cancer risk. Endocrine disturber, we have pellets, we have BPA, we have pesticide. All of this coming from any plastic packaging, your cosmetic product, and even the pesticide that you spray. These may affect your hormone, causing you to have obesity, diabetes, and reproductive system affecting. And lastly, industrial chemical, formaldehyde, benzene, isocyanide, that will affect your, causing you increase the DNA, cancer risk, respiratory disease, or immunity. So again, the key principle when it comes to chemical is cumulative, as I mentioned, low dose cumulative exposure over time. Example number 3, environmental pathway, the built environment, the heat and the noise. Panas, Malaysia sekarang during our heat wave, we can go up to 35 to 36 degrees Celsius. Panas, and then most our places which don't have the aircon, then you will start feeling the heat stress yourself. So not only about the chemical, some are also physical and social space around us. Why? Because the built environments will affect the activity. If there is no green space or the safe working space, people become more sedentary. Malas lah nak bergerak. Tak ada tempat nak exercise. Tak ada tempat nak jalan. Panas nak buat exercise. Bising nak buat exercise. So we don't do exercise. If there's a noise pollution, you tak nak buat exercise. If there is a heat, then panas keluar, tak nak buat exercise. So then nak pergi gym, tak ada duit nak pergi gym. Nak pergi gym kena bayar. So all of these were causing us to have increased number of the metabolic disease. Heat stress, very common in tropical country. Noise, tempat tu kalau bising, dia jadikan anda stress. Kalau increase of the noise level, will increase of the blood pressure, increase your cardiovascular risk. Heat stress I mentioned just now. Heat stress can increase the cardio workload and also will worsen the kidney risk, especially for outdoor workers and elderly people. UV radiation linked to skin cancer, artificial light at night can disturb the skin sleep and also the circadian rhythm. So all of this is your built environment, which no wonder your metabolic chronic health disease never been managed well. Because every time you leave the hospital, you go back to where you live, you are still exposed to the hazard. Another example. Now, risk factor number 6. We mentioned a lot of risk factor just now. Number 1, behavioral risk factor. Benda yang boleh tukar. Contohnya, jangan minum arak, jangan smoking, jangan vape, makan sehat. Behavioral risk factor. Second one, is what we talk about the physiological risk factors. Okay. Whether you have the existing metabolic disease, you have you are obese or whatnot. Third one, gene, family history. Number 4 is what we talk about socioeconomy. Okay, socioeconomy is one of the factors where people are having certain chronic diseases. That's why you will be easily see that there are certain chronic non-communicable disease are very common among people who are low-income family. Number 5 that we mentioned just now, environmental risk factors. What about environmental risk factors? Chemical exposure, heat exposure, noise exposure, the environment that you live in, air pollution, water pollution, and everything. And now, number 6, occupational risk factors. These are some of the examples that I print screen. What do we see? Work can expose people to dust, chemical, noise, heat, shift work, long sitting, heavy lifting, poor ventilation. First article, high prevalence of hypertension in agricultural village. Meaning to say, if you are the farmers or you live in an agricultural village, you have the high chances of the hypertension. Why? Because of the chemical that you're exposed to causing you to increase the hypertension. Why? Because of the environment. Increase of the temperature will cause increase of the hypertension. Living and working environment. Second article, association between metabolic syndrome and shift work in the chemical plant workers. So chemical plant workers are exposed to chemical. That is number 1. Exposed to chemical that will affect their endocrine system. And then because of working shift work, they are living upside down. Malam tidur, dia orang kerja. Pagi orang kerja, dia tidur. So when the hormone is being disturbed upside down, shift work, it's affect their hormone as well. So that's why there is an increased number of metabolic syndrome among the people who working in shift. Number 3, effect of hazardous chemical exposure on cardiovascular disease. Exposed to chemical, tempat kerja anda, contohnya kerja di kilang. Kilang tu guna chemical. You kerja kat situ, there is an increased chances of you having the cardiovascular disease. And last one, diabetes in the workplace. Hypoglycemia. See, all of these are the workplace environment. So next time, if you are the pharmacy or if you are the nurse, if you are the doctors, before you ask like, what is your lifestyle? Do you drink alcohol? Do you smoke? Do you vape? What are the food that you eat if you are the nutritionist? Other than asking all these questions, try ask another one question. What is your job? Kerja apa, Pak? Kerja apa, Bu? Ataupun, where do you live? Tinggal di mana? Rumah dekat dengan kawasan perindustrian, rumah dekat dengan jalan besar, rumah dekat dengan tempat sampah, rumah dekat dengan mana? Because all of these were affecting their metabolic disease. So this table, I try to summarize different occupation will have a different hazard and different non-communicable disease. You can see if you are from the mining and constructions, then you were exposed to silica dust, asbestos, you have the increased number of the respiratory disease. If you are from the manufacturing and factory, then you were exposed to the chemical, then you have a disease. If you are working in the agriculture, exposed to the chemical, disease. If you are the healthcare workers, then you might be thinking, I'm the healthcare workers, I'm not exposed to any chemical. No, if you are the healthcare workers, you handle formaldehyde, right? You handle cytotoxic drugs for the dialysis machine. Or people who are having the chemotherapies, you exposed to all these cytotoxic drugs. And you exposed to latex. You are wearing latex glove every day. So if you realize the skin diseases are very common among the healthcare personnel who are using the latex glove because they are sensitive to latex rubber. Lastly, then you see that luckily I'm working as an office worker. No. If you are working as an office worker and if there is any cleaning agent used in the office or if there is a sofa with the fire retardant, all of this will causing you to increase the indoor air quality problem and you will have another metabolic disorder. So here is to tell you that the job that you choose were also affecting your metabolic disorder development. Then, what about shift work? What about sedentary behavior and psychosocial stress? There are three occupational pathway very common today. Shift work, kerja siang malam. Ataupun for example like nurse, or if you are a pharmacy, you might get a shift at night. So shift work, prolonged sitting. You duduk je, tak buat apa pun. Asyik duduk je bagi ubat, asyik duduk je bagi arahan, asyik duduk je buat komputer. Prolonged sitting. Psychosocial stress. So let's talk about the shift work. Shift work will disturb your circadian rhythm. So when you affect your circadian rhythm, it will affect your sleep, your hormone, your glucose metabolism, and immune system. If you prolong sitting, you tak berdiri, duduk je main computer, it will reduce your muscle activity, you will increase your insulin resistance. Even when people exercise, sometimes it will still affect it if you prolong sitting 8 hours memang tak bangun, 8 jam duduk tak bangun. Psychosocial stress, you are high demand, low control, bully, job insecurity, all will increase the cortisol level. If your cortisol level increase your reactive oxygen species, increase your ROS, increase your oxidative stress, then you will cause inflammation. This is especially important for nurse and also pharmacy because a patient may not take medicine at night at the right time because of night shift. Contoh, kita bagi ubat, pharmacy bagi ubat, nurse rujuk pharmacy bagi ubat kepada orang diabetes. Contoh. Tapi orang yang ada diabetes tu, dia terpaksa kerja. Itu rezeki mah. Nak cari kerja, nak cari duit, nak cari rezeki. So, dia kerja night shift. So, macam mana dan waktu dia kerja night shift, it affect dia punya hormone. Dan, sebabkan kerja night shift, waktu jam dia makan ubat akan lari. Do you see the picture now? So, waktu kita bagi ubat, waktu bagi nasihat, let's ask, kerja apa pak? Duduk kat mana? Jenis kerja tu apa? Alright? And because all of this were affecting. Now, let's look at this. This slide are telling you occupational disease is a major public health issue. Many work-related deaths are caused by non-communicable disease. When we talk about occupational safety, banyak akan cerita, occupational safety. Ada orang jatuh dari tinggi ke tak? Ada orang mati sebab accident ke tak? It is not only about that. So occupational health is different. It's about the cancer from the carcinogen chemical that you use at the workplace. It's about respiratory disease from the dust and the fume. It's about cardiovascular effect from noise and the stress. And it's about the chronic pain from ergonomic hazard. These are all we call as the global occupational burden and non-communicable disease. So tadi when we talk about the environmental hazard, I ask you to ask the patient, duduk mana, tinggal di mana, rumah di mana, rumah dekat dengan jalan besar ke, dekat dengan kilang ke, dekat dengan tempat buang sampah ke, dekat dengan mana. That is very important message. You got the message, you will know that kenapa saya punya patient tak pernah okay, tak pernah baik pulih, tak pernah recover because keluar dari hospital balik rumah, this is the environment they are living in. How you want them to escape? Tempat kerja. Kalau dia kata saya ambil ubat diabetes contohnya, tapi pergi kerja masih exposed to chemical which will trigger their metabolic disorder. So again, it will goes back to the same thing. Now, look at this graph. I try to give you the example so that you will better illustrate what happened outside there. If you look at this graph, this is a combine all the factors into one causal chain. Behavior risk factor, we mentioned, right? Occupational risk factor, physiological risk factor, environmental risk factor. So different risk factors that we mentioned just now can influence the chronic disease. It's all started from the moment you say, I want to change a job. So you change a job, it will affect your food choice. Sebab you kena bangun awal pergi kerja. Contoh, you kena bangun awal pagi, masuk Jakarta pergi kerja. Contoh, you duduk, I don't know geography in Indonesia, but I've been to Jakarta once and I know how jam is that. And I know that there are a lot of people every day come in Jakarta to work and then leave Jakarta. That's what I know. So now imagine, you change job. You got a good job in Jakarta, right? You have to wake up 4 o'clock in the morning, 4 a.m., 3:30 you dah kena bangun. And then you masuk Jakarta untuk kerja. Because of change job, it will influence the food choice. Sebelum ini, you akan makan sehat. You boleh makan, bangun pukul 6, 6:30, makan pagi, sarapan, proper food before you go to work. Because you change job, you change your food choice. When you change your food choice, you makan apa yang ada. You makan makanan yang you fast food. You makan tempat yang cepat hadam. And then you cause obesity. When you're obese, you have hyperlipidemia. And then you have the chronic atherosclerosis. And then you have myocardial infarction. Or, because of change of job, you don't have the time to do exercise. Contoh, pukul 4 you kena bangun, 4:30 you kena keluar rumah, masuk Jakarta, kerja. Balik, jam another 2 jam, sampai rumah, you nak tidur saja. You tak nak bangun dah. And because of lack of physical activity, it will increase your chances of chronic disease. Or, change of job, you stress. Waktu stress, you smoke. Alright? So when you smoke, increase the coronary pollutions, increase the myocardial infarction. Apa lagi? Change your job. Kerja kat Jakarta, stress. And then stress, and then sambung lagi, shift work. Then, hormone effect causing hypertension. Or when you stress, you got emotional disturb, and then sleep quality, and then you have the hypertension. So all of this were kind of telling you that the reason of someone getting the non-communicable disease,
Terus tanggal
someone is talking, minta tolong mute-kan. Terima kasih. Minta tolong mute-kan. Terima kasih.
Panitia ada yang bosan.
Juli ini banyak lagi.
Please, if can if possible, try to mute kan, alright, because
Yes. Stop.
thank you very much. I couldn't do that. I'm not the co-host. Thank you. Okay, so you can see the whole picture. The whole picture is to tell you that when every time someone comes to you of having the chronic disease, stop blaming by telling you, sebabkan you tak makan sihat, sebabkan you tak exercise, you gemuk sebab you tak jaga diri. It is more than that. Maybe about the job that they choose, maybe about the place that they live. So there are many factors. As a public health personnel, we can ask, we can check before we start giving them the ideas that you gonna exercise. Kalau dah kerja shift work macam ni, macam mana dia ada masa untuk exercise? Right? So there are a lot of things that we need to consider when it comes to the non-communicable disease, because it does affect. Okay, next. Let me know if you have any questions. Okay, now this is to tell you the death, kematian from the non-communicable disease that's reviewed by the environmentalists by region. We are from the Southeast Asia, so let's look at the Southeast Asia. As I highlight, you can see that ischemic heart disease, many coming from air pollution. So it's not only about the second-hand tobacco smoke. You might be thinking that, tobacco smoke, kalau dia merokok, dia ada heart disease. Not only about that. It's also about the household air pollution. Macam mana rumah ada air pollution? The chemical that you are using, the cleaning agent that you are using, you smoke in the house, and so on and so forth. All of these household air pollution. You cuci baju, tempat tu tak ventilated, rumah tertutup 24/7, and then it's not ventilated, masuk rumah ada satu bau, household air pollution. Ambient air pollution, you keluar daripada rumah, motor, kereta, haze, industry emission, or ischemic heart disease. Secondary tobacco smoke contribute, but the environment contribute even more. Stroke, lung cancer. Lung cancer, people might think that, sebabkan you merokok, then you have the lung cancer. Not only that, household air pollution, ambient air pollution, occupational risk. Kerja tempat tu akan high chances of you getting the lung cancer as well. COPD, all of this. So stop blaming people like you are the lung cancer because you smoke. Not only about that. It's about their environmental and occupational health exposure. And another thing, is the Southeast Asia. How many percent of this that contribute? I will actually share my slide with Ibu Yayo. So I think Ibu Yayo later on or Ibu Ani can share my slide with all of you so that you can read again. And here, it's almost towards the end of my slides, so that I can open for a Q&A session. The slide actually gives a very strongest message in the whole talk that I'm trying to summarize. A healthier environment can definitely prevent a large number of kematian. There are actually nearly 2/3 of the death caused by environmental factors are due to non-communicable disease. That means that environmental health is not only about infection, not only about sanitation, not only about waste. It is about heart disease, it's about stroke, it's about cancer, it's about diabetes, it's about respiratory disease and kidney disease. So if we cantikkan, if we bersihkan, if we strengthen our environment, we are also strengthening the chronic disease prevention and management. Now, this is what I mean. Earlier, we talked about the standard NCD, right? With standard non-communicable disease approach. We give a dietary counseling. You have to eat this, you have to eat this. We ask people to exercise. We give people ubat. We give them antihypertensive, insulin, statin. We ask people stop smoking. Yes, it is important. All of this, don't get me wrong. All of this that I listed here as standard non-communicable disease is super duper important. Weight management, very important. All of these are important, no doubt. But what happened? What we offer, what we often miss is here. Home, workplace quality. Home and workplace air quality. The chemical exposure. The built environment. The noise and heat stress. Occupational hazard. Early life environmental exposure. All of this is something that we miss when it comes to chronic disease management. I want to share some of this is a real things coming from me. I want you to imagine, okay, so my husband is a ambulance paramedic. So he worked in the hospital as the ambulance paramedic. So he ride the ambulance and then he's the paramedic in the hospital. He used to be the paramedic in the hospital. So when you work in the hospital, you work shift, right? And so what happened is he will go night shift. And then during the night shift, of course, if you are in the hospital as a paramedic, you cannot sleep, right? So then he doesn't sleep. He cannot sleep. He has to pick up the call. And he eat. He eat a lot at night so that he can stay awake. He drink coffee. He drink benda manis to stay awake. So basically the whole night when people are sleeping, he is working. It's very familiar for the nurse and also for the pharmacy. And so what happened is, after years of working as a paramedic in the hospital for the ambulance, for the A&E department, accidents and emergency department, my husband last year, I think most of you can relate, he is 178 cm height, tall. Let me type so that you have 178 cm tall, height. And then his weight is 127 kg. Weight. You do the BMI calculation, you know that he is now definitely obese. If my husband stand in front of me, you can't see me at the back. That kind of idea. And I don't blame his job. This is his job. It's just that during the night shift, he can't not to eat. So then he keep eating. And after years of working, then now he become obese. So then we decided to change his job. So now he's work for a private sectors on the normal shift, no longer on the shift according to the hospital. He quit his hospital job, still a paramedic, but for the ambulance services outside the hospital. And then his weight now dropped to 120 kg in 6 months' time because now he has time to eat proper food. He has time to sleep at night. He has the time to exercise. My husband are not smoking. My husband is not a smoker. My husband not even vape. And then as a Muslim, we don't drink. So the only reason that caused him fat or obese and cannot lose down over the year is because of shift work and not having enough sleep, shift work, and then eat all the night. So now, after 6 months, he's quit, now joined the private sector, work a normal shift. He is now in 120 kg. In 6 months' time, for me, it's a success. And now we have enough time to exercise. He has enough time to cook for himself, not eating outside, and he has enough time for all the weight management suggested by the doctors. You get what I mean? Occupational factors. So when we come to non-communicable disease care, what we often miss is the air quality, the chemical exposed, the work environment, the noise, the work stress, occupational hazard, and also the early life environmental exposure, which I will talk about that later on. Okay? You can, Okay, now this slide shows that things are not in one factors, one of the things that I forgot to mention is about my mother-in-law, which is my husband's mother, passed away because of diabetes and stroke. My father-in-law, which is my husband's father, passed away because of lung cancer. So if you want to talk about genetic, my husband definitely high risk group. And because he is high risk group, he is comparable to his co-workers, he ex-colleague, more high chances of getting all this metabolic disorder. That is the reason we decided to quit hospital and work from the private sectors. You see what I mean now? Because of his genetic, he's high chances of getting stroke, diabetes, and lung cancer. I remember how I take care of my mother-in-law as a stroke person. I remember how I have to take care of my mother-in-law food because he is very high diabetes. And I'm my father-in-law. So now my husband is high in genetic, and then because of his occupational risk factors, two things. If you look at this, my husband obese is because of number 3 and number 6, occupational factors and genetic. But all of these are interconnected. So as for the interprofessional point of view, I think if you are the nurses or if you are the pharmacy, next time before you only check about ada minum ke tak, ada smoking ke tak, we have to also ask about their environmental and also their occupational factors. Okay, so I love this graph. Why? Because it tells us that the socio-economic model is actually influenced by many, many layers. At the center is the individual, where we have the age, we have the sex, we have the genetic, we have the pre-existing condition that you can't change. I can't change my age. I'm 40 years old this year. Inshallah, my birthday is October. So this year, I'm 40 years old. And I know the fact that I have to take care of my own self. The age is something that I cannot change. Gender is something I cannot change. Genetic is something I cannot change. Pre-existing condition is something I cannot change. But behavior is something I can change. Social factor is something I can change. I can decide whether I want to have the good diet, whether I want to smoke, what kind of physical activity I need to choose. Behavior is something I can change. Social is something I can change. The social support, my ethnicity is something I can change. And lastly, the environment. I can choose to live in a good environment. I can choose to live in a good air quality, the water, the chemical, the built environment. This is what I can choose. So for the interprofessional work, each profession can act at a different layer. The nurse and the pharmacy, you guys work closely with the patient, chat with the patient. Public health, environmental health, you work at the community and the policy level. You see the picture? Now, this is something that I wanted to share before we go to the conclusion. There are one terms that are concerned, which is what I call DOHAD, Development Origins of Health and Disease. I repeat, DOH, we call DOHAD. So DOHAD means to say that developmental origin of health and disease. In a simple word, exposure early in life can affect the health many, many years later. Exposure may happen during pregnancy, during infancy, during childhood or adolescence. For example, like PM 2.5, endocrine disrupting chemicals, the lead, the household toxin, the school air quality, and the pesticide exposure. This exposure may change the gene expression or affect the organ development. The result may not appear immediately, but the person are more high risk or high chances to develop cardiovascular disease, diabetes, cancer, kidney disease 20 to 40 years later. This is why maternal health, child health, school health, environmental health are all connected to the adult chronic disease prevention. Okay, so I repeat, this is why when we talk about health, how do we prevent this? It's okay. I think this is the last. That's why I wanted to write down maternal health, children health, school health, and environmental health are connected to adult chronic disease prevention. How you choose you live your life, it will ultimately affect your an adult chronic disease development in the near future. Okay, so that's the slide talk about. Okay, now I was asked to talk about interprofessional role, and I got to know that you guys are coming from different background. Some of you are coming from public health, some of you are coming from environmental health, some of you are nurse, some of you are pharmacy, some of you are occupational health. So this is my pledge. Public health and environmental health specialists work strongly at the upstream level. You do not only respond to sick individual, they try to change the condition that make people sick. People always ask me what I do as an environmental occupational health professional. I said my job is to make people not to get sick. That is the job as a public health and environmental health people. Our job is we wanted to change the environment so that less people get sick. So our role include environmental health risk mapping, population surveillance, policy advocate, community engagement, exposure assessment, and health education. For example, you map the pollution hotspot, you compare the pollution hotspot with the non-communicable disease prevalence. You were surprised to identify the heat island, industrial zone, and also the food desert. You can also conduct a health impact assessment, support the clean air policy, safe water standard, urban green space, and safer workplace regulation. This is prevention before the disease becomes severe. For example, if one particular community has many asthma cases, and that particular community, their house is near an industrial area, what do we do for a public health and environmental health specialist? You get what I mean? If that particular area have an increased number of asthma, and that is the industrial area near the area, and the clinic and hospital keep receiving the patient having the increased number of asthma, what do we do to the public as a public health and environmental health specialist? Another example, nursing. Nursing are often the first and the one who closest professional contact for the patient. So this gives a nurse a very powerful tool, a powerful role in detecting environmental and occupational trigger. So then I prepare mnemonic. So it helps you to structure the question. Next time when you meet someone, ask question. Investigate their current work. Where are they working? So you want to know where they got the asthma, where they got the cancer, where they got the diabetes. Ask where they're working. Ask their work environment detail. Ask where they live or are. Ask their environmental concern near their home. Ask their past work, whether sebelum dia ini kerja apa. Ask their activity. What are their activity? What are their hobby? What are their community living? Ask their referral and resources need. What is their past genetic? What is their past medical history? What is their family history? And then educate and empower the patient. So what nurse can do is recognize the occupational trigger. From now onward, you have to start thinking about using the I Prepare mnemonic to start checking on the patient history. Recognize the occupational trigger. Recognize the home exposure, environmental exposure. Check on the chemical exposure support the shift work and advocate for referral. If necessary, you have to refer them to the occupational environmental health where the exposure is suspect. And what about pharmacy? This is important. When it comes to the pharmacy, after the nurse has already checked by using the iPrepare, the nurse will pass the information to the pharmacy. So the pharmacy will sort of having the ideas of what this particular community working as. Why is this important? Because as the pharmacy, you have to support the medication adherence. You have to check the drug interaction. You have to counsel the patients. You have to monitor unusual response. For example, heavy metal and some chemical may affect the drug response. And in all, they will increase the toxicity. And so if you know that the workers are working in the area where they are working in the industry where they are handling arsenic, lead, or cadmium chemicals. So these chemicals are likely to affect the drug response. So you have to match the drug and the medication, or you have to monitor closely. Shift work may need special advice. If they are working on shift, what is their best timing for them to sleep and eating your medicine? All right. So this is what we call interprofessional role. And lastly, if you are the occupational health specialist, focusing on preventing the disease related to work, we think about this in 3 layers: primary prevention, secondary prevention, and the tertiary prevention. All right. And last one, which is, I think this is my last slide as a take-home message, is I leave it purposely for a practical framework so that you can remember, ask, assess, act, advise, and advocate. Always ask about the environmental and occupational history. Where do you work? What are you exposed to? What fields do you cope with? Do you live near the industry or the heavy traffic? Second, assess the risk and the pattern. Are the symptoms worse on the work days? Are there similar cases in the same workplace or community? Number 3, act on the root cause. Do not only increase the medication. If they go back to their home, the exposure continue. Number 4, advise the patient, the family, and the employer on the practical change. And last one, advocate. Other than telling people to eat healthy, sleep well, do exercise, stop smoking, stop vaping, which all of them are important. Also consider where are they living, where are they working, how they live their life. Because all of these will affect things, the non-communicable chronic disease management. And so I want to end my slide with this. The chronic disease management is not complete if we only treat the patient, but ignore the environment. That will make the patient sick. Because interprofessional collaboration will allow us to move from treating the disease to control the root cause that around the patient, which include home, community, and work. So last, before I end my session and pass it back to Ribu Yayut, treat the patient. I keep saying this even to my student, treat the patient, but also need to understand the place and the work that shape the patient disease. Thank you very much, and invite you to ask any questions. But before I end, I wanted to put this in the chat box so that you can remember as a take-home message, which is again and again, check the patient, but also understand the place and work that shape the patient disease. All right, thank you. Thank you very much. And I see any question? Oh, I see. Do I need to, Ibu Yayu, I read the question out, or you wanted me to read the question out? Macam mana?
Okay. Thank you very much, Dr. Vivien, for the insightful and inspiring presentation. Your presentation has reminded us that chronic disease management is not only about lifestyle change and medication, but also about understanding the environmental, occupational, social, and community factors that shape health outcomes. Doc, sorry, Dr. Vivien, we sincerely apologize for the slight adjustment into this program. Due to a prior commitment, our rector has just joined us. Before we proceed to the discussion session, we would like to invite the rector to deliver a special remark. Is it okay, Doctor?
Sure, 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 sure.
Yeah, okay. Please welcome Bu Mega, uh, our rector of Universitas Pendidikan Utama Kudus. Bu Mega, time is yours.
Alright, thank you. Okay, terima kasih. Hello. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
First, I'm sorry, due to some reason I joined the Zoom late a bit. Ya. Minta maaf sekali lagi untuk Bu Vivien, Dr. Vivien, karena saya terlambat untuk ikut join the international expert lecture today. Alright, this distinguished Professor Vivien Hao, respected lecturer and dear students, on behalf of Universitas Pendidikan Utama Kudus, I would like to express or sincerely appreciate to Professor Vivien for the insightful and inspiring presentation. Sangat menarik sekali for your education, for your presentation, and for your experience the public health. And the topic of environmental and occupational health in quantitative management is highly relevant and provides valuable perspective for our lecturer and our students. We hope the today's session will not only enrich our knowledge but also open opportunities for future academic collaboration between Interprofessional Pendidikan Utama Kudus and University Putra, Malaysia. I hope next future and collaboration to university. And thank you once again, Prof. Vivien, for sharing your expertise with us. We wish you continued success in your academic and research efforts. Once again, thank you, and I will wait your answer in Universitas Pendidikan Utama Kudus today. Yeah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Assalamualaikum warahmatullahi wabarakatuh. Thank you very much, Bu Rector, for your inspiring remarks. And we would like to proceed with the presentation of the certificate of appreciation to Professor Vivien Hao, our distinguished speaker today. May I kindly invite Bu Rector to present the certificate to Professor Vivien Hao. Silakan Bu Rector untuk menyerahkan sertifikat penghargaan kepada Dr. Vivien Hao.
Terima kasih banyak.
There's a lecture today. Terima kasih banyak dan next collaboration and next activity and to university dan sukses untuk kedepannya kita dan Putra Malaysia dan khususnya untuk kita dokter. Thank you.
Assalamualaikum. Terima kasih sebab berikan peluang untuk saya berkongsi topik ini kepada pelajar daripada Institut Teknologi Kesihatan Pendidikan Utama Kudus. And saya minta maaf that I speak more English than Malay. But don't worry about the content because I think the Ibu Ernie also Ibu Yayu can share my slide with you. If you have any question that you wanted to have the further discussion, I'm more than welcome to discuss with all of you.
Right. Thank you, Bu Mega and Dr. Vivien, Bapak Ibu, ladies and gentlemen, we will now proceed to the discussion and question and answer session. For participants who would like to ask questions, please use the raise hand feature or write your question in the Zoom chat box. Kindly mention your name and your background before asking the question.
So I actually see a few questions here. So maybe I can read that question out.
Okay.
Okay, so thanks for all the questions. So wait okay. Thank you, Siti, Nu, and Jayani. So the question is like this. As a diploma in pharmacy student, we have mainly been trained to focus on medication therapies and patient adherence. Today's the presentation has broadened our understanding that environmental and occupational factors can also affect the treatment's outcome. Based on experience, what additional knowledge or competency should diploma in pharmacy student develop to prepare ourselves for delivery comprehensive and evidence-based pharmaceutical care in the future? All right, thank you, Siti. Very good question. I think that is also the same question that asked by Putri Dayana. So I will read out as well, because I think I will answer that together. In a hospital or primary healthcare pharmacy practice, how can pharmacy technicians identify whether a patient's poor therapeutic outcome is caused by environmental or occupational exposure rather than medication not adherence? All right, so because there are two questions from pharmacy, so I will answer that question before I go to the question from Muhammad Faiz, which is the nursing. All right, so that is the thing. I think not only in Indonesia, even in Malaysia, we have been trained as a professional. So as a professional, we've been trained to work professionally in a silo, meaning to say that pharmacy will work as a pharmacy, right? Public health and work as a public health. It's not only in Indonesia, don't get me wrong. I think in most of the Southeast countries is like that. A doctor work as a doctor, as a public health work as a public health. We don't interrupt people. We don't disturb people. In Malay, we say, kita tak kacau orang. Kita buat kerja sendiri. Alright? So that is the problem. So now, what we are trying to bring out to even to in Malaysia, in our own hospital as well, is to keep telling them that, because usually the one who will treat the patient is the nurse and the doctors. So we will let the nurse and the doctor having the ideas of the knowledge on environmental and occupational health. So the patient history, before this, our patient history are very much on the family history, their behavior lifestyle, their food lifestyle, that's all. So now we are training the doctors. The doctor in Malaysia now, they were taking the subject on public health, especially on environmental and occupational health. So we want them to also understand the fact that when you are diagnostic patients, it is not only about one factors. It is not only about the behavior factors. There are more than that. So we have one particular topic also we call as a risk communication. So if you ask me, I think a pharmacy student should first develop environmental and occupational health awareness, which is ask the patient before you give out the food or before you give out the medicine, are you taking your medicine? This is what we usually ask, right? Now ask, where do you live? What kind of work do you do? Are you exposed to chemicals? Is your work environment and sorry, can we mute? Sorry, saya minta maaf. Bisa mute. Okay, sorry. And then number one is because UPM, University Putra Malaysia, we have bidang medical doctor. We don't have pharmacy. So for medical doctor, we start training them having the knowledge and awareness on environmental and occupational health. And we train their skill on risk communication, which is patient may, even because when it comes to risk communication, patient sendiri tak tahu, pesakit sendiri tak tahu, they may not always understand how their workplace, their home environment, or their lifestyle affecting their health. Most of the people will be thinking, lifestyle affecting chronic disease. Not many aware that work environment and home environment will affect people's health. So That is how we train our medical doctor in UPM. We train them having the knowledge on environmental occupational health. We train them on the risk communication skill to write down in their sleep of the patient record, not only about the lifestyle, but also where they work and their home environment. And then because everything is in the computer, so they will pass this information later on to the pharmacy department and to the dietetic department. So that is how we start training our doctor to see things beyond. And because we don't have the pharmacy program in UPM, so we start doing this to the student from dietetic and also to the medical doctor. So if you go to at least our hospital, university hospital, the doctor will not, the doctor will usually ask, how is your lifestyle? And after that, they will ask, where do you work? Where do you live? And they will put down everything in their report card. And this patient's history will later on pass it to the pharmacy sectors or later on pass it to the dietitian sectors. So I think if you ask me, senior already knows the importance and the integrations of this, stop working silo and start working professional. I'm not saying Malaysia is a successful one, which is actually not yet. I think Malaysia and Indonesia, we share the same non-communicable disease problem, which is increased number of obesity. Yes, increased number of diabetes. I think we share the same thing. Betul, Ibu. Yeah, you betul. So I think we have to start slowly by helping them. My husband has been working in the hospital for the past 10 or 15 years. Can you imagine? I've been using months, if not years, to convince him to quit. I cannot stand that he has been from 90 kg when I married him, and then 100, and then 105, and then 110, until 127. Betul-betul sudah gemuk. I cannot. Then I have to convince him, you have to quit. Initially, I asked him not to eat during his shift work. But jangan makan waktu shift. But it's impossible. And every time dia keluar, ambulance keluar ambil patient, balik kalau pukul 3 pagi, makan. 3:30 ambulance keluar ambil patient, balik pukul 4:30, makan. Pagi ya, bukan petang, makan. Makan gemuk. So it's all about awareness, right? So you are the diploma. I mean, now you are still fresh and you still have the knowledge. So if you go to degree level, because now you are in diploma, right? So if you go to degree level, you will talk about toxicodynamic, toxicokinetic, about how the medicine that will interact with the chemical component. So that is where you best to shift the medicines and whatnot. Okay, I hope that answer your question for Diana and also Siti Noor. Now I want to go to the next question, Muhammad Faiz. Saya jarang tengok nursing jarang in Malaysia tengok lelaki nursing. Very good in Indonesia. Yeah, Malaysia we are lacking nurse in lelaki nurse. Most of our perempuan nurse. Thank you, Muhammad Faiz. So my name is Muhammad Faiz. I will address what environmental factor is most commonly overlooked by the public, even though it has a significant impact on the development of chronic disease. Overlooked by the public. Well, I would think that remember there are 6 factors that I mentioned. Lifestyle, everyone knows that, oh, you makan banyak manis, you akan gemuk, you tak exercise, you akan gemuk. Benda ini semua orang tahu. You smoking banyak, you akan ada masalah asma. You vaping, you akan ada, you ambil drug, you akan ada masalah. Semua orang tahu. Dan kalau you kerja di kilang, if you are working in the industry, working in the kilang, you have the occupational safety and health people. So you know that your kilang are dusty. You know that your kilang has a lot of chemicals. Benda ini ada pakar daripada occupational health tolong kalau you kerja di tempat kilang. What people overlook is living environment. So the living environment is what people overlook. And it's very skeptical if you want to go and tell people, contoh, you pergi rumah orang, you bagi tahu, rumah awak bahaya. No people will like it. You can't go to a people place and tell, you have to, you have to open the window, you have to open the door, your rumah bahaya, your rumah not supposed to use this, your rumah not supposed to use that. People don't like it. And so if you ask me what is the main overlook, this is the main overlook things. Right? Because no people like you to go to their home and then complain about things. You cannot go to people's house and say, don't eat this. These are all unhealthy food. Wow, you have a lot of Coca-Cola in your fridge. This is unhealthy. wow, you are using this thing to burn, wow, unhealthy. Wow, your washing machine is in a non-ventilated area, so you are inhaling the chemical every day. As a public health people, I find it difficult if I have to go to people's house and say things like this to people. But as a nurse, I think you can also start building up the awareness by letting people know the 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 factors, the housing living environment. There is actually a list. I'm not sure if next time I have the chance to share with y'all again, I can share you a list of the checklist where I share with my student that you can go to people's house and do the checklist on how unhealthy the household is, so that you can do this. So this is what I do with my student. I show them if you wanted to live healthy, you have to start from yourself. If I'm allowed to share you one of the example, I won't say I'm a very practical people, but I'm very particular, I would say. So when I buy my house now, when I choose my house now, I purposely not choose the new building house because I don't want to live in a house newly built and have bau cat. Sebab bau cat tu bahaya. So I don't want to live in that kind of house. I purposely choose a house which depan rumah saya tak ada jalan besar. Depan rumah saya hutan. You get what I mean? Depan rumah saya adalah hutan, tak ada jalan. Tak ada jalan langsung. And my house is an old house. It's a old lady passed away, so I buy the second house. My house tak ada aircon. The reason my house tak ada aircon, sebab kalau saya pasang aircon, nanti akan increasekan the heat outside. Environmental health. So saya tak nak ada heat outside. So saya rumah tak ada aircon. But Malaysia is hot. Very hot. So what I did, you know indoor plant, right? Pokok yang tanam di rumah. You know indoor plant, ada pokok yang boleh tanam di rumah. Okay. So this is macam joke, but it's a real story. So during my pregnancy, saya mengandung, first trimester tu, I tell my husband, but rumah tu waktu tu rumah dah pindah masuk tapi tak ada aircon. I tell my husband no aircon. We are the environmental health people, no aircon at all. You know, we don't want to contribute to the to the environmental pollutants. Very extremist. So during my pregnancy, you know pregnant, right? You guys are from the healthcare, you know lah. Pregnant people akan rasa panas. First trimester saya rasa panas. Badan saya besar. Saya kecil tapi badan saya sudah rasa besar. And then I tell my husband, tomorrow you free ah? Can you change your shift ah? Then my husband say, what you want to do? Then I say, saya nak pergi beli indoor plant. So, then okay lah. Dia pun layan. So, saya pun pergi beli indoor plant. So, rumah saya, kalau you datang rumah saya, anyone if you come to Malaysia, come to visit my house, you masuk rumah saya, indoor plant. Semua indoor plant. Ruang tamu, semua indoor plant. So, because indoor plant akan sejukkan hati mah. So, indoor plant semua. Daripada ruang tamu sampai ke dapur, indoor plant sahaja. Then, second trimester. Dah bulan 4, 5, 6 lah second trimester. Dah makin besar kan. And then one night, I asked my husband, what is your shift tomorrow? Tomorrow night shift. Ngam. Tomorrow teman saya. Nak beli indoor plant. Nak beli indoor plant. Makin panas. Anak awak makin besar. Saya panas. So beli indoor plant lagi. First trimester beli indoor plant kecil macam ni. Second trimester beli indoor plant besar macam ni. Sebab tak tahan. Panas kan? Not my fault. Pregnancy mah. Still, don't want to pasang aircon. And then until the final trimester, perut dah sangat besar. And then waktu tu, heat wave. El Nino, heat wave. Saya sudah tak tahan. And that night, I asked my husband, bang, esok free ah. Nak beli indoor plant ke? Nak beli aircon. So my house, if you come to my house, there is only one aircon. Bilik tidur sahaja. Ruang tamu masih indoor plant. Tempat makan masih indoor plant. Cuma bilik tidur sahaja aircon. Sebab tak tahan panas. Pregnant woman. What I'm trying to say here is, Faiz, your question is, how difficult is that? Even a practitioner like me, I have to end up, I also cannot tahan. I pun tak tahan. Saya pun kena pasang aircon. And rumah saya, dulu saya punya washing machine dalam rumah. Tapi sebab tak ventilated, so selalu ada bau detergent. And I know that bau detergent is not good. So saya pindah the whole washing machine keluar rumah. Tempat yang ventilated. So orang lalang tu, akan lalu rumah, akan nampak saya punya washing machine kat situ. And my husband say, this is not nice. I was like, I don't care about how people think about. I just care about whether the chemical would expose inside my house. So you come to my house, you will see the washing machine outside because it's well ventilated. I'm not even making this up. This is a real story, Faiz. So if you ask me, difficult or not? Difficult. Living environment, you ask people to change living environment as if you ask people to change to renovate their house. That much of difficult. Tempat masak, kalau tak ada exhaust fan, kan, bau tu dia akan affect kita punya lung. Air fryer, kalau kita guna air fryer, tempat yang kita guna air fryer tu, kalau tak ada pukat tingkap, tak ventilate, that air fryer akan keluar particulate matter affecting your lung. So all of these are affecting the living environment. So as a nurse, if I give a chance next time, I will share you the checklist. So at least next time you can use the checklist, to chit-chatting with your patients. So at least you know what is the main cause. Kalau tak, you bagi dia ubat asma, you bagi dia ubat balik, rumah yang sama. Exposure yang sama. So dia akan selalu balik bagi tahu, samalah doktor, samalah, tak ada berubah. Memang tak akan berubah because you are going back to the same hazard. Can I? I hope I answer your question, Faiz. For health students in developing country like Indonesia, what is the simplest daily habit change we can recommend to patients to protect the environmental toxin? Very good question. Malaysia pun tak berjaya lagi. Malaysia is also a developing country. A daily habit living environment toxin is, when you say environmental toxin, for me, there are two environmental toxins. One is the indoor air pollutants. All right, like I mentioned just now lah, making sure that your house is well ventilated all time. Rumah jangan selalu tutup. You tengok orang zaman dulu sakit tak? Jarang. Rumah zaman dulu, pintu buka, tingkap buka, semua buka. Tapi sekarang dia tutup. Masuk rumah buka tingkap ada bau, buka pintu ada bau. That bau is actually dah lama kat situ. That is number one. The simple daily habit, keep your living environment ventilated at all time. Ventilated. Right? I keep repeating this. Keep your living environment ventilated at all time. I know this is very difficult, especially consider our security now. Ada pencuri lah, very difficult now. So, zaman dulu you nak tengok orang asma tak banyak. Zaman sekarang banyak. Rumah selalu tutup, not ventilated. You pergi rumah orang, you ada satu bau. Pregnant. It's a artificial pregnant. It's not natural. You pergi rumah saya ada bau pantan. Sebab tanam pandan ke rumah. Natural pregnant. Take the natural things from Allah. Allah cipta banyak benda, you ambil dia, pinjam dia daripada dia. Second one is chemical. So there's a lot of chemical used in our environment. Rule of thumb is, I always tell people, even I tell my students, know what you are using. Use only what you know. Now let me type this out. This is important. Know what you are using and use only what you know. If you don't know, don't use. Auntie, I consider myself auntie at 40 years. So if I go to buy anything, I will look at their chemical ingredient before I buy. I will get stuck in the cosmetic product. Malaysia, we have Watsons and Guardian. I will look at all that product until my husband dragged me out and say, if I keep looking at that, people will drag me out. So I buy detergent also, I will check their chemical ingredient. The rule of thumb is simple. You have to know what you are using and use only what you know. If you don't know, don't use. There will be another one-day course to talk about the chemical, which I am not being allowed because 11:30 I have another meeting. I tell, so sorry. But rule of thumb is know what you're using, use only what you know. If you don't know, don't use. If that thing, another rule of thumb, if that thing is cheap, murah, then confirm 100% industrial chemicals. Kalau dia, faham tak? Kalau benda tu murah sangat, it definitely is an industrial use chemical and you are allowing an industrial use chemical in your house and your house is not ventilated. Tell me how you live safely. Cannot ma, right? Emma say, my name is Emma and I'm a lecturer. Hi, Dr. Emma. With your permission, I would like to ask a question based on your experience. Are there any major difference between Malaysia and Indonesia in addressing environmental factors? Differences, yes. I don't know much about Indonesia, but I think as a Southeast Asia country, kita jiran. Kita serumpun, kita jiran. So as a jiran, I think we kind of living in the similar cultural background. And especially in Malaysia, the environmental factors are more or less the similar. The difference is we have a more rajin punya enforcer when it comes to the environmental factors. So when it comes, let me split it into two different components. The first component is the environmental factors coming from kilang. So we have a very strict enforcer to enforce to making sure that this thing doesn't goes out. That is for the occupational safety and health and our Department of Environment. But when it comes to living environment, I would say lebih kurang sama. Lebih kurang sama. And it not making much changes. So I know this in person because apparently I'm Chinese. Very obvious. So mata pun sepek kan. So I'm a Chinese and my husband is a Malay. So the reason I say this, no much different because as a Chinese, I friend with Chinese. I'm from a Chinese family. My mother's still a Chinese. So Chinese family would have a different setting when it comes to living environment and different mindset, different awareness when it comes to the environmental awareness. Malay community, my in-law side, my husband and in-law side have a different awareness when it comes to the environmental awareness and environmental factors. So my jiran is India. So when I go to my jiran house, I know they have an environmental awareness pun beza. So when it comes to the environmental factors, sama. Noise ke, heat ke, sanitation ke, water ke, pollution ke, lebih kurang sama. But how we manage that, different. And how we manage that, there is no one set of example. Because in Malaysia, different bangsa, different ethnicity will have a different awareness when it comes to the environmental factors. I hope I answer your question. So in Malaysia, it's become very challenging. Kita kalau buat program, kita kena target bangsa yang berlainan. Kita kena guna bahasa yang berlainan sebab unlike in Indonesia, everyone speak one language. But in Malaysia, you know, like if in the Chinese community, they like people who can speak Chinese. If you are in a different community, they will speak different language. So bahasa Malaysia, even though it's our bahasa bangsa, but when it comes to delivery, you have to use different language and to target different group. That is our difficulties. Factor sama, faktor sama, tetapi cara deliver, cara address beda. Okay, I hope I answered your question, Emma. If we could meet each other later on, then I think we can have a more detailed discussion. I think last question. If a patient is aware of their non-communicable disease may be related to occupation, but they cannot avoid their exposure due to financial reason, what approach would a healthcare professional usually take in managing the situation, right? Very good question, Galo. So as a healthcare professional, we cannot do much because itu tempat dia cari rezeki, tempat dia cari duit. But it's good that now you already have the knowledge. Abang, pakcik ini, bapa jadi macam ini bukan sebab bapa salah. I pernah jumpa patient sangat negatif. Saya macam ini, Vivien, saya punya dosa lah, waktu saya sudah sampai lah, Tuhan sudah panggil lah. Very negative. Then I say, Papa, it's not your fault. It's your tempat kerja. It's never about you. You eat healthy, you exercise. I mean, of course, dia tak ada masa exercise. You eat healthy, you eat simple, you lead a decent life. Duit cari tu pun halal. Not your fault. Bukan Allah panggil. You just need to take care of your health. Very negative. So the same thing I tell the bapa, the same thing I tell you. So please go and tell the people outside. You cannot change your job. Yes. But you can change how to take care of yourself. The least that I can do is, kalau tempat kerja tak bagi PPE, beli sendiri. Kalau tempat kerja tu dusty, jadikan dia ada asma, ataupun tempat kerja tu dusty, berhabuk, jadikan dia ada heart disease, advisekan dia, tempat kerja ada bagi PPE tak tutup. Kalau tak ada, beli satu set untuk sendiri. These are the least we can cadangkan untuk dia. Faham tak? So maksudnya, unless tempat dia ada occupational safety and health punya enforcer yang kuat, macam Malaysia, I would say that our occupational safety and health is quite strict and enforced. Unless dia ada tu, kalau tempat dia memang tak ada, at least cadangkan kepada dia. You have to let them know, Papa, you sekarang ada asma, ada heart disease, bukan sebab awak, sebab tempat kerja anda, tadi you kata you kerjakan mining. Tempat tu berhabuk. That's why, walaupun you makan ubat, you punya simptom tu akan increase. Cadangan saya, invest sikit, belikan satu mask tutup waktu pergi kerja. So you can reduce the symptoms while you giving them the treatment. Did I answer your question? I hope so. All right. Any questions? I'm not sure if I can leave my email address here, Ibu. If Can I leave my email address here? I'm
Sure,
not sure. This is my email address. Open for discussion. There is a lot that we can discuss. And we have only 50 minutes here, but there's a lot that we can discuss. I'm sure that we can discuss that next time in the near future, inshallah. Thank you very much.
Okay, very interesting. Know what you are using and use only what you know. If you don't know, then use it.
Betul.
Interesting,
Can
better.
can we take a
So,
picture?
okay, sure.
Macam mana kita nak ambil gambar?
Betul.
Thank you very much for joining the sessions. I'm sorry if I talk too fast.
No problem, betul. Before we close today's session, we would like to invite all participants to join a photo session. May I kindly ask everyone to put on the screen for a few moments? To the documentation team, you may now capture the photo. I will give the instruction. 1, 2, 3.
Dengan aku DWA Pak Gunadi.
Screen berikutnya 1, 2, 3. Screen berikutnya 1, 2, 3. Okay, thank you very much.
Terima
everybody.
kasih semua. Sorry that I need to run to another meeting, but thank you very much. I enjoyed the session. InsyaAllah nanti kita akan jumpa lagi.
Okay. Thank you, Dr. On behalf of the committee and all participants, I would like to express our sincere appreciation to Dr. Vivien for sharing valuable knowledge, experience, and perspective with us today.
Terima
Thank you
kasih.
once again,
Asal.
Dr. Vivien. Selanjutnya untuk partisipan ada absen yang bisa diisi dengan barcode. Silakan di share barcode-nya.
Oh,
Madya.
foto kurang ketok tak tutup deh.
Terima kasih Ibu. Saya silakan diri dulu ya.
Terima kasih, Profesor
Thank you.
Vivien. Thank you so
Assalamualaikum.
much.
Bye-bye.
Waalaikumsalam. Thank you, Miss Vivien.
Thank you and have a wonderful day, everyone. Assalamualaikum warahmatullahi wabarakatuh.
Warahmatullahi wabarakatuh. Thank you, Ayu. Terima kasih.
Waalaikumsalam warahmatullahi wabarakatuh.
Bu Yayu, terima kasih. Selamat melanjutkan studi.
Terima kasih Pak Janji.
Jangan lupa cepat lulus ya.